We are recording now.
Thank you. Well, Carol, take it away.
Okay, friends, welcome. Welcome to Open Enrollment Webinar 2022.
No, 23.
23.
23.
But we're preparing for 23. I'm Carol Bruce. I'm your benefits officer here in the Texas Annual Conference and the Center for Connectional Resources. And your leader today will be Barbara Kilby, who is our benefits manager, and also Brian Johnson, who is with Alera, our group health benefits consultant, will be presenting. One other person I'd like to introduce to you that you see hopefully on your screen is Robert Besser is with us. Reverend Robert Besser is an associate director here in the conference office, but he has already been nominated by the Council on Finance and Administration to be my successor. Many of you know I am retiring December 31st of this year, and Robert is the new me. So he's in training to be the benefits officer and treasurer for the Texas Annual Conference, and we're so grateful that he is with us for this meeting today. So before we begin this holy work, Barbara's going to be giving you instructions on how to complete forms if you want to make changes, and informing you about the few changes that are coming at the beginning of 23. But first, I think we should begin in prayer to our great physician, thank God for our health, and ask God's blessings over this holy work. Who would like to pray as we begin today?
I will be glad to.
Thank you, Robert.
Let's pray. Lord, it's good that we gather in our respective places around the computer to be in ministry together. We're thankful for the benefits of the Texas Annual Conference to provide for our clergy and our clergy families and our congregations for their support. We ask for your blessings upon our time together. We're thankful for Ryan and his team as well, and for the benefits of the conference. Pray your blessings as we move forward in ministry together for this time of discussion and looking forward to the future. It's in Christ's name that we pray. Amen.
Amen.
Amen. Thank you, Robert. Barbara, lead us. Thank you.
All right. Thank you so much. And we want to let you know, Carol, how much we appreciate your leadership the past, what has it been, 3 years, I think?
Thank you. It's been a privilege to work with all of you.
You've made a huge impact for good in this department and the conference. So we're very, very grateful. And we're grateful for Robert. He is a bold and courageous man to step into this right at this point in time.
Amen.
And we're very grateful. And thank you for everyone for participating today. Mr. Peanut is telling us it is open enrollment time. So we are going to look at what we need to look at for 2023 open enrollment. As you know, open enrollment every year, it's the same time, November 1st through 15th. So this is your one time per year where you can make any benefit changes you like, any benefit plan changes, and medical, dental, or vision, any dependent changes you might want to add or term. So this is your opportunity, and all plan changes will be effective next year on January 1. So just the nuts and bolts, we mailed out your open enrollment packets. They went out on Tuesday. So hopefully you'll be getting those in the mail in the next couple of days. They're big 9x12 envelopes. They have a little tagline on it that says, please open your open enrollment packet. So please open those and review the information that's included. And we will have all of the OE documents posted on the website by November 1st, hopefully today. Our webmaster is working on those for us. And then if you can't remember, because every year people don't seem to remember what they're actually enrolled in, we highly recommend, if you have not done so, if you just go to the boonechapman.com website, go to the member portal login screen and set up your own account. And there you can review your plan elections and coverage elections. You can get explanation of benefits, claims information. You can order an ID card if you need one. So it's really helpful, but that's the best place to find out what your current plans are in case you don't remember exactly what you're enrolled in. You can also contact our office, of course, if you need that information. And then, as in all years, if you're not going to make any plan changes for next year, you do not need to submit an open enrollment form. We will carry forward your current 2022 plans and coverage levels into next year. However, if you do want to make plan changes, then you do need to submit a group health benefits enrollment form to our office by November 15th. So the group health benefits enrollment form is on the website. It's currently there under important forms, but it'll also be there under the open enrollment materials. So submit a group health benefits enrollment form if you do want to make plan changes for 2023. And then, as in previous years as well, in your packet, loose on top, is that beautiful Boone-Chapman additional insurance form for 2023. As you know, if you have dependents, you do need to submit that form. Complete it, please, and submit it to Boone-Chapman by January 1. That is for coordination of benefits, and they do limit dependent claims that they'll pay to $1,000 until they get that form every year. So if you would go ahead and get that in right away to Boone-Chapman, that will be taken care of, and there won't be any delay in your claims processing. And then one other thing I should remind you, if you do submit a group health enrollment form, please print neatly. Sometimes we have a hard time figuring out what those letters are and numbers, and we want to make sure we get the accurate information. All right. Oops, I think I went the wrong way here. Let me go this way. All right. 2023 benefit changes. The good news is there are not any. How about that? We do not have any benefit changes for either the standard PPO or the high deductible plans for next year. There are no changes in the deductibles or the out-of-pocket maximums for 23. There are no benefit changes in either the Humana Dental PPO or the Humana Vision plan. And our wellness and walking program incentives are also remaining the same for 2023. And even better news for you clergy, there are no changes in the clergy group health benefits contribution rates for your medical coverage or in the Humana Dental or PPO or vision plan premiums for next year. So on the clergy side, no rate changes, no benefit plan changes for 2023. So everything is going to be very consistent. All right. The one change that will occur for 2023 is the church group health benefits contribution rate is going to increase from 9.8% to 11.2% effective January 1, 2023. And you may recall because, oops, sorry, I hit my little cursor there. You may recall, because this has been in the Group Health Benefits Report to Annual Conference for the past 4 years, we are in a 4-year pre-approved process of moving from the group health benefit apportionment to solely collecting all of our contributions to fund our group health benefits solely through the church and clergy monthly EFT drafts. So the apportionment started out back in 2020, it was at $2 million. And we have been reducing it by $500,000 each year. So in 2021, it went from 2 million to 1.5 million. This year in 22, it went down to 1 million. Next year in 23, it'll go down to only 500,000. And then by January 1, 2024, the group health benefit apportionment will be $0. So it will be completely eliminated at that time. And so this rate increase is not really an increase per se, it is to offset the lack of group health benefit apportionments, the reduction that we've been going through, this annual 500,000 reduction to eliminate that apportionment completely. So that's really what that rate increase is doing, is really just shifting from apportionment to the monthly collection rate that we use for the church. One of the reasons behind doing this is that, as you are aware, every church has a group health benefit apportionment currently, whether or not they actually have a clergy that's eligible to participate in our plan. Only clergy that are appointed either 3/4 time, 75% or 100% are eligible for benefits in the Texas Annual Conference. So if you're 50% or less, you are not eligible. And that those churches with those clergy have still had a group health benefit apportionment. So this is going to make sure that only the churches and clergy that are eligible to participate in the group health plan will actually be paying for those benefits, which is a more equitable approach. All right, now there is a salary sheet change, and I hope all of you have been working diligently on your salary sheets for 2023. We know that's such a fun process. You enjoy that every year. But this is some good news. I don't know if you've noticed this or not, but we have been working with Cabinet for a number of years to get this change to occur. And we are very grateful that Cabinet did agree to do this. So effective January 1, 2023, so in your 2023 salary sheets, accountable reimbursement amounts are no longer going to be included in the calculation that determines what the pastor's total group health benefits compensation is for purposes of calculating your church and clergy benefit contribution amount. So if, as you know, this year, accountable reimbursements has been included as part of total group health benefits compensation. However, due to WestPath rules, accountable reimbursements have never been included in your pension plan comp. So currently, if a clergy does designate an AR amount in their salary sheet, and not all clergy do that, but if that does happen, the clergy's total group health benefits compensation will be higher than the clergy's pension comp by the amount of that accountable reimbursement. So you'll have two different plan compensations. So I think if someone can mute, I think we're getting a little noise there. If possible, please make sure you're muted if you don't mind. So the good news is, starting in 23 now, because accountable reimbursements will no longer be part of group health benefits compensation, regardless of whether or not a clergy does designate any accountable reimbursements, your total group health comp and your total pension comp will be exactly the same amount, whether or not you designate any accountable reimbursements. Now, accountable reimbursements are still included in minimum salary. That's an equitable compensation decision. And accountable reimbursements are still part of your Cabinet workbook compensation. That's a Cabinet decision. So those amounts are not being affected. It's really just your total group health benefits compensation amount that will no longer include any accountable reimbursements. So I don't know if you can see this. Let me make this a little bit bigger. The salary sheet. So these are kind of a side-by-side look here on the salary sheets, but here's your 2022 salary sheet. And if you notice the colors, the pension section is yellow, group health is green on this 2022 section salary sheet, and then the Cabinet workbook section is in blue. So if you notice on this sample salary sheet for Peyton Manning at Canton NFL One Church, B.T. Williamson set this up years ago, so he did that. But anyway, so this sample salary sheet for this pastor has pension cash of $48,000, a housing allowance of $12,000 for a total pension plan comp of $60,000. The pastor has designated some accountable reimbursements, $5,000, but those are not included in pension comp. This is your 2022 salary sheet. However, if you go down into the green section for health benefits comp, that $5,000 is included. So that means your total health benefit comp is $65,000, whereas your pension comp is only $60,000. because pension does not include that 5,000. And then down here in cabinet workbook, that 5,000 is still part of the cabinet workbook compensation amount, which does not include the housing. All right, so here's 2023, and you can see this change. So I want to get rid of that over there. Okay, here we go. So this is our 2023 salary sheet. So you notice again, it's the same salary, 48,000, 12,000 housing, a total pension plan comp of 60,000, 5,000 accountable reimbursements is not included in that total. But likewise down here in group health, the 5,000 accountable reimbursements is not included in your total health benefits comp. So that means your pension plan comp is 60,000 and your total health benefits comp is also 60,000. So this will actually result in, if you do designate any accountable reimbursements, it's actually going to reduce the amount that you will pay, as well as your church, for your group health benefits for next year. So even though the rate hasn't changed, due to this change in the salary sheet, you would see a reduction if your comp remained the same and nothing else changed for next year. So we wanted you to be aware of that little bit of good news. All right, there's one other thing we did want to bring to your attention. If you've noted in the group health benefit reports for the past several years, our active clergy group health plan has been having some fairly significant operating deficits for the past several years, and really to the tune of about $3 million annually. And we've been able to manage those very successfully because, thanks be to the good Lord, we have some really strong reserves, and we've had incredible investment returns until this year. So we've been able to offset those operating deficits, meaning we're actually spending more in our claims and expenses than we're taking in receipts. So we've been able to manage that successfully with our investment returns and so forth. But looking down the road long term, that is just not sustainable over the next several years. So the Group Health Benefits Committee has directed the benefits team, the benefits staff here in the conference, and our consulting team, Ryan Johnson, as we mentioned earlier, and he'll be doing a presentation in a minute. He's our with our Alera group, our benefits consulting group. We've been directed to look at alternatives for our current active clergy group health plan. So why are we experiencing these deficits? There are a lot of reasons, but one of the significant reasons is when you compare our group, our members that are participating in our plan, to say the average kind of employer plan across the nation, the average age of our clergy is much higher. And that's just representative of what's happening in our denomination and in other mainline Protestant churches. So that's not unusual, but as we know, with age, healthcare claims costs tend to go up as well. And while being a pastor is an incredible and glorious blessing, it also has a lot of stress associated with it, and certainly in the past several years. And we know that stress can impact our health and create some of those chronic issues that we can deal with. And our clergy do struggle with many of those chronic conditions, such as diabetes, high blood pressure, and high cholesterol. And also, just a word to all of you, we know that as caregivers, you often tend to put yourself at the bottom of the list. And we do need all of our clergy to really engage in appropriate self-care, because that's what's really beneficial to you individually, to your family, and of course to your church and your ministry. So we do have some gaps where pastors really are not really doing all that they need to be doing optimally for preventive care and medication management and so forth. So those are some of the underlying reasons, but regardless, we need to find a comprehensive long-term solution to provide a sustainable group health plan going forward for our active clergy and their families. And And of course, right now we're trying to figure out the impact of the local church disaffiliations, how that's going to impact not only our participants in the plan for next year, but also our churches that remain and are participating. So we will be meeting, we have some extra meetings scheduled this year and early next year to try to get a handle on kind of the total numbers and where we stand. And we will be making some recommendations to the Group Health Benefits Committee, which will be included in 2023 Group Health Benefits Report to Annual Conference with regards to some proposed plan design changes for 2024. So that notice is also in your open enrollment packet on the last page of the overview. It's really a heads up. We just want you to be aware of that and be attentive to the recommendations and so forth that we include in our report to annual conference next year. So before we go on, Ryan Johnson, as Carol introduced earlier, is going to talk to us about the benefits of a high deductible health plan and setting up a health savings account. But before we do that, I'm going to stop my screen sharing here. And I know Carol was looking at the chat. So Carol, do we have any questions? Or if anyone has a question, feel free to just unmute. We can certainly do that as well.
There was one question in the chat, Barbara, about just what was cabinet workbook compensation, and I'll let that participant know that that is the number assigned to compensation of a clergy that's on the cabinet table when appointments are made. So it's really a sort of fictional number that doesn't impact you. It's a way that the cabinet members can fairly consider compensation as one part of the appointment process, if you will. So that's the only question so far. Anybody else have a question, friends?
Just let me add to that. The way cabinet workbook compensation is calculated, it includes your salary, your cash salary. It includes any housing related allowances and utilities, and it does include accountable reimbursements. It does not include your housing allowance in lieu of parsonage or your parsonage value. So it really, cabinet workbook are the components of minimum salary, which is cash salary, housing related allowances and utilities, and accountable reimbursements, but does not include housing allowance or parsonage value. So that's how that number is calculated. But as Carol said, the cabinet uses it to compare side by side when they're making those appointments. So yes, any other questions that anyone may have? Not seeing anything. We've tried to keep it simple the past several years. You know, as you're very well aware, we've been through 2 years of COVID with just unbelievable stress and changes and unknowns for everyone. And so we've intentionally, at the cabinet and bishop's direction, tried to keep our benefit plans very stable the past couple of years, so we could minimize at least one level of stress for people, hopefully. So that's what we've been trying to do. But again, going forward, we're going to need to look at making some of those benefit plan changes. And so we will make you aware of those as we provide those recommendations. So if there are no further questions, if anyone thinks of any, we can certainly take them again, but I am going to mute, and Ryan Johnson is going to lead you through the presentation on the high deductible health plan and a health savings account. So take it away, Ryan.
Thank you, Barbara. And thank you all for having me here today. As Barbara and Carol mentioned, my name is Ryan Johnson. I am a consultant and have worked with the conference here for a few years. Our entity, OLERA, helps negotiate your plan with the carriers and also help with service and claims issues along the way. And one of the things I want to talk with you guys about today is helping you better understand what the high deductible plan offering is and how it works with a health savings account. So this is something we've had in place for many years. We have seen more participation grow over the last few years of more people moving from the copay plan That's known as your standard PPO, is how you guys are naming it with your group. We've had more people move from that plan over to the high deductible plan. And I just want to make sure you guys have a really firm understanding of what that means and how they work so that you can make a really good decision for yourself and your family for your 23 elections. So the first big item to realize and understand is both plans, whether it's a high deductible plan or your standard PPO, have the same network. They're both using Aetna's Signature Administrators PPO network, and they cover the same conditions and the same pharmaceutical drugs. So there's not a difference or a takeaway from coverage. The big difference between a high deductible plan and a PPO copay plan is the cost share. So it is more expensive in premiums to be on a copay plan. And so one way to think about it is you're almost prepaying for services, as opposed to a high deductible plan is a lower cost on the front end, and then it's a pay as you go approach. So just kind of a big picture to understand, they're the same networks, they cover the same conditions, they cover the same drugs. It's just a difference in cost share. Do you want to pay up front or pay as you go? So on the high deductible plan, if you were to enroll in this plan, like I said before, you'll have access to the same network, the Aetna Centers Administrators Network, to get the discounts that have been negotiated between Aetna and that particular provider. So whether it be the doctor, the hospital, or the pharmacy. You will also be able to open a health savings account. And this provides you with a debit card that you can use to pay for your medical, dental, vision expenses on a pre-tax basis, okay? A couple of clarification points on this is you can see that the word here is debit, which means you have to have money in that account in order to be able to use it, okay? So it's not a credit card account, it's a debit account. Another important item to clarify on this is you can only pay for expenses out of this HSA debit account. You can only pay for expenses that have been incurred after you've opened that account, okay? So if you're on a standard PPO plan in 2022, you choose to go on to the high deductible plan in 23, but you have a bill from 2022, you cannot use your HSA dollars to pay for that 2022 bill. It's only for items that have been incurred after you've opened the health savings account, okay? So just a piece of clarification to make sure you're aware of. And by the way, the slides and some summary information will all be available on the website, as Barbara mentioned earlier. So you don't need to worry about screenshotting these or taking copious notes. We'll make sure that they're available for you going forward. So in order to participate in the HSA, you have to be enrolled in the high deductible plan, okay? An HSA is a special tax advantage account where you can put in money tax-free, and you can earn interest on it as well through some various investments. And all your withdrawals are tax-free, provided they are paying for qualified expenses, which I'll get to in a moment. One thing that a lot of people are aware of are they've heard of flexible spending accounts in the past. So think of this similar to a flexible spending account where you're putting aside pre-tax dollars. One of the big differentiators is an HSA. The money it's not a use it or lose it. It actually rolls over year over year. So you can fund your health savings account in 2023. Anything that does not get used in 23 rolls over into 2024 and 25 and so on. So it is a bank account in your name that will always be available for you to use those funds. So you own this health savings account and you keep the funds in that account if you change insurance programs, if you were to not be part of Texas Annual Conference any longer, or not be part of the health plan with the conference, that money is always still your money. It's not a use or lose it. You're not going to forfeit any of those dollars. You can kind of think of it as like a 401k of sorts for your health expenses. So you can put aside this money that could be used for any of your medical, dental, vision expenses throughout the rest of your life. So you can withdraw the money directly from your HSA using your debit card, or you can allow it to grow over time. So there are some people that will enroll in a high deductible plan, open an HSA, they'll fund it, and they'll actually use post-tax dollars, say out of their checking account or their credit card, to pay for those expenses. because they want that HSA funds, they want those to continue to grow on a tax-free basis, kind of like you would have a 401k. That is entirely up to you of how you want to do that, but it's just available for you to do. There are some IRS limits on your contributions of how much you can put in there. So if you're enrolling in single coverage for 2023, the maximum contribution is $3,850 per year. If you're enrolling yourself plus your dependents and on either employee plus spouse plus children or family coverage, the maximum allowable contribution for 23 is $7,750. If you're over the age of 55, you can add an additional $1,000 on top of those limits there as well. These are IRS limits that do get adjusted each year. The family coverage goes up usually about $100, and the single coverage goes up usually about $50 every year, just kind of tracking with inflation. So who's eligible for an HSA? These are governed by the IRS. Okay, so in order to open and fund a health savings account, you have to be covered under a qualified high deductible health plan. So the health plan being offered through the conference is a qualified high deductible plan. And basically what that means is you do not have copays to go in for services up until a threshold. Okay, so if you're going in for your annual checkup, your well woman, well man exam, that's covered at 100% no cost on both plans, as long as it's a preventive visit. If it is moved to a diagnostic office visit, then you would pay the contracted rate that the provider has with Aetna. Okay, so a big understanding is to understand the HSA has to be paired with a qualified high deductible plan. Okay, if you are enrolled in a spouse's plan that is not an HSA qualified plan, like actually has copays, then that would disqualify you from opening and funding a health savings account. Now, if you were to enroll in this year in 23, and then in 24, you want to change back to a copay plan, like I said before, that money is all yours. So you've not forfeited those dollars that you put aside in 23. But if you're on a copay plan in 2024, you would just not be able to add more money to your health savings account once you're no longer enrolled in a qualified high deductible plan. You also cannot contribute to a HSA if you're enrolled in Medicare, TRICARE, or TRICARE for Life. Anything like that, if it's another employer's plan or a governmental plan that has copays, that would disqualify you from funding a health savings account. You can't be claimed as a dependent on someone else's tax returns. You cannot have VA benefits within the past 3 months. You or your spouse do not contribute to a health FSA. So if you're on a health FSA, that would also disqualify you from a health savings account. So it's your responsibility to understand the rules about HSAs and if you're eligible for them or not. If you have questions, you can get with the benefit team here at the conference. We'll do our best to help guide you, but ultimately we can give you information, but it's, if you have other coverage, it may be up to you to determine if you're eligible or not. For contributions, so you can fund your health savings account with tax deductible money. Similar to an IRA, you can fund it up until tax day the following year. So your 2023 contributions can be funded all through 2023 up until the tax date of 2024. Okay, so you have a little bit more time to do that. You can change your elections on a month-to-month basis with the HSA. So you can put aside money on a regular schedule of $50 per paycheck, or you could do, $1,000 in January, $1,000 in February, and then you could ratchet it down to zero if you wanted to at that point. It's up to you, and you could add back to $50 a month later on throughout the year. It's totally up to you of how you're funding your health savings account. It is your account. It is all your money. It is just a tax favored account that you'll have to keep track of for your taxes. So you can make your contributions directly into your HSA. And if you're doing that, let's say you're moving it from your checking account where your paycheck is deposited over to your HSA account, you would just need to file Form 8889 with your 1040 income tax form to make sure you're getting credit for those pre-tax dollars being moved over. You can check with your church that you're associated with to see if they can direct pre-tax payroll deductions directly into your HSA. Okay, so that is on a church by church basis to make those determinations. You can set up an HSA with your preferred bank. So if you bank at Bank of America, Wells Fargo, wherever that may be, they may offer an HSA account option. So you could open it there, or you could choose to go to HSA Bank. There are many banks out there. This is just one of the options that's open to you. There's a website right here. It's pretty simple to go ahead and open that account. It is just like opening any other bank account. It's going to require information about you, but it's all things that you have to open due to the Patriot Act, because it is a individual banking account. It's not something that the conference can open for you. And as I stated earlier, you can start funding that account once you are enrolled in the qualified high deductible plan, which if you're on the standard copay plan in 22 and you move over in 23, on January 1, you could start funding your HSA, but you would not be able to fund it prior to being enrolled in that qualified high deductible plan. So distributions are all tax-free if they are for qualified medical expenses as defined by the IRS code 213D. So there's a complete list. You can Google the qualified high deductible HSA expenses. You'll find a very exhaustive list, but really think about it as your medical, dental, vision expenses. Okay, so the out-of-pocket expenses that you would incur related to some of these items you can see highlighted here would all be qualified expenses under an HSA, which would not incur any penalties. Now, if you were to use your HSA for non-qualified expenses, let's say you wanted to do your Christmas shopping and buy a bicycle for your kids, that is going to be a non-qualified expense. And you're going to be subject to a 20% penalty, as well as start paying income taxes on that, because you avoided income taxes on that money initially. So you'll pay income taxes plus a 20% penalty on that. After you reach age 65, you could use your monies that you put in your HSA to help pay for Medicare and Medicare related expenses like your Medigap or your Medicare Part B premiums. All those would be qualified expenses. You also could use that money for other expenses not medical related when you're over 65 and not incur that penalty. I believe you'd still be paying income taxes on it. I cannot give you tax advice. You need to check with your CPA on that, but you would not incur the penalty. So for 2023, these are the contributions that you will pay based off of your salary, your income to enroll in the high deductible plan or your standard PPO. So you can see the percentage of income is higher if you enroll in the standard PPO plan. And that's because that plan is more costly from a claims perspective. One of the things I mentioned earlier, it's like you're prepaying for services. So in order to have a lower deductible, have copays, you're going to pay a little bit more upfront for that. So that's why you see the percentages are higher on the standard PPO than they are on the high deductible plan for all of our tiers here. And on the next couple of pages, I have a couple of scenarios outlined if you were to enroll in the high deductible plan versus the standard plan, what your cost might look like. So if I'm a healthy single person with minimal expenses, I can enroll in the high deductible plan. I'm going to pay 4.6% of my salary. Your conference average is around 90,000, so that would be 41.85 is what you would pay annually to be enrolled in the high deductible plan. If I were to go in and get a monthly generic prescription that was $15 per month, I'm going to pay $180 annually in those expenses. And let's say I go in for a couple of office visits as well. So I'm going to pay $220 in office visits, $180 in my pharmacy, for a total out of pocket of $400. My overall expenses for the year would be my premiums of $41.85 plus the $400 of the out of pocket, a total of $45.85 would be my total out of pocket expenditures between my premiums and my medical and pharmacy care. And if we compare that on the right-hand side to your standard PPO, I'm going to pay 6.75% of $90,000. So I'm going to pay more in premiums up front. My deductible is lower, right? So I have a $1,000 deductible on this plan, and I have copays for pharmacy and for my doctor's office visits. So let's say we had the same drug at $15. My office visits are now $30 a piece, or $60 total. My total out of pocket is $240. So my overall cost for the year is $240 plus $60.75, a total of $6,315. So in this scenario, my costs are $1,730 more if I were to enroll in the standard PPO plan. Okay. Again, this is just a scenario to kind of show you a way to do the math on your own. If you were to look at your personal experience or your family's experience over time, you could make a better judgment on what might work for you. Some kind of rules of thumb: an office visit, this is, I'd say, pretty standard, somewhere in that $110, $130 range. It depends on the doctor. It could be higher, it could be lower. Just depends on that doctor's contracted rate with Aetna. A specialist office visit might cost you 2, 3, or 4 times that amount, as opposed to your copay. Drugs are all different costs, just depending on what that drug is. If it's a generic or a name brand drug, they're all going to have different amounts, and they're also going to cost different amounts at different pharmacies. So it's really important for you to shop around. One of the things that you'll hear these high deductible plans called are consumer-driven healthcare plans. The reason for that is people are typically better consumers on these plans because they're shopping around for care, because they don't have copays. So if you do enroll in the high deductible plan, you are incentivized essentially really to ask your doctor more questions. Do I need that test run? Do I need that drug? Is there a lower cost alternative? Could I go to an urgent care versus an emergency room? All things that would save you some out-of-pocket expenses. So this is just a simple scenario. If we go to the next and last page on this, this is another scenario of if I'm a single person that reaches my out-of-pocket limit, what might my cost look like? Again, we're doing the same contributions here of $4,185 versus $6,075. If I hit my out-of-pocket max on the high deductible plan, it's $4,500, which also includes my pharmacy. So my total out-of-pocket costs for the year on medical expenses is $4,500, and I've paid $4,150 in salary. So my total expenditure is $86.85. And if you compare that on the right-hand side of the copay plan, you would pay $6,500 in medical plus pharmacy, plus your premiums is $12,575. So your worst case scenario is actually better on the high deductible plan, as you can see over here, okay? Because my out-of-pocket cost is lower and my premium costs are lower. I would encourage you to be thoughtful and do the math on your own and for your own family to figure out which plan might make the most sense for you. One other important item of note, the standard PPO does have the memorial write-off. The high deductible plan does not, okay? And that's a function of IRS rulings that it's not allowable to have that. So it's something to be mindful of.
Ryan, you said memorial, you mean
Excuse me.
Houston Methodist.
I apologize. Thank you, Methodist. So the Methodist write-off applies to the standard PPO, but not to the high deductible plan. So you can look at how that may offset your costs on this as well. Thank you, Barbara. So these 8 slides, like I said, will be available if you want to review them. There's also available on the website, similar to what we had last year, a little bit of an overview. It has the same information that I covered here verbally. This PDF is quick 2-page summary that includes really all the same information that we had on those 8 slides, just consolidated into 2 pages. It includes on here some links to the IRS website of allowable expenses, and also the link to how to set up a health savings account down here.
And Ryan, we do have one question in the chat, if this is a good time.
Yes, ma'am, it is.
Okay, are those rules regarding spouses applicable if the spouse is on a non-conference plan?
Good question. So I think the question would be here, right? So if your spouse is on a copay plan, let's say with, Houston ISD, okay, and you're on the conference plan with a qualified high deductible plan, you could fund your health savings account. You can enroll in the high deductible plan, but you would not be able to get that family limit. So depending on your situation and where you're enrolling your kids, if you had kids, it may affect your HSA eligibility. But essentially, you could not benefit from your spouse being on a copay plan. You can't double dip is really kind of what you need to kind of look at.
Great. Katie, did that answer your question? And are there any other questions, friends, for Ryan? Oh, several questions.
Yes, it did answer my question. Thank you.
Great, Katie. Thank you. Okay, Mike has a question, several questions. Does switching to HDHP/HSA, switching to a high deductible plan, affect teledoc benefits? Let's ask that one first, Ryan.
Great question, Mike. It does not. So both plans do have telemedicine. The cost share would be a little bit different from the standard PPO to the high deductible plan. So again, both plans have all the same benefits from a medical perspective, but a little bit different in cost share. So you pay the contracted rate that Aetna has with the telemed provider.
Yes, so under the standard PPO plan, it's a $0 cost to use teledoc services. Under the high deductible plan, you pay a $55 per teledoc visit fee until you meet your deductible, either $1,850 single or $3,700 plus more than one. And then it would be your 20% coinsurance. So yeah, there is a real difference. As Ryan said, the same benefit, but the cost goes from zero under standard PPO to you pay that $55 per visit fee, which is still considerably cheaper than an in-person doctor's office visit, but you would pay that fee out of pocket until you meet your deductible. And then you'd have a 20% coinsurance is the way that would work.
Okay, thanks, guys. That was awesome. Are there any benefits for churches, employers, to participate in pre-tax payroll deductions?
Barbie, you want to take that? Or me too?
Okay, well, that's our Section 125 plan. So if your church has set up and they need to, in fact, that's going to be on the website. I sent all the open enrollment documents to our webmaster last night. And so everything should be up on our website for open enrollment, hopefully today, but if not by Monday. But yes, if your church has set up a Section 125 plan, then as long as they deduct your clergy contributions from your paycheck, not all churches actually do that. So what a Section 125 plan does is allow that church to make those deductions for your medical, dental, and vision on a pre-tax basis. But you must set that up prior to January 1 of next year if you don't have it set up already. It carries forward year to year. You don't have to do one annually once you set it up and it's approved by your administrative council at your church. It's set up for the future, one and done. But if your church hasn't done one, contact me. I will give them the name of, I guess, is April Hernandez going to be handling that? Or
yes, our team will continue to help provide a template if you need a Section 125 document. And like Barbara said, you need that if you're taking out pre-tax deductions. And really, it's a policy that just says, I'm not going to let people change elections throughout the year unless they have a qualifying event, is really what that is. And so it gives you the rules to allow you to do that.
And Mike, I know some churches literally put that before their church conference, their annual charge conference every year. They just pop it on the agenda to make sure that's done. But you want one and done, as Barbara said, if you do it once, either your church council or church conference can approve that.
And also ours is a premium only plan. So it's only, the only things that you can do pre-tax under our conference umbrella Section 125 plan is your medical, dental, and vision monthly contribution amounts. It's not for other out-of-pocket unreimbursed. It's not a flexible spending account. You can't do childcare deductions or anything of that nature. It's just your monthly medical, dental, and vision contribution and premium amounts that can be done on a pre-tax deduction basis.
Super. Thanks for those great answers. And Mike has one more great question. If we were to switch back to a PPO after being on the high deductible plan with the HSA, does the HSA balance remain?
The answer is yes. So that money is always your money. You'll never forfeit it. It stays in your name. It's a bank account that travels with you, no matter what your employer is, or if you're not employed, that this debit card, this bank account will always still be your money. If you switch over to a copay plan, like your standard PPO plan, you're not going to be able to continue to add more money to your HSA from your checking account. But that money that's in the HSA stays there and can continue to grow tax-free if you have investments in it. But you just cannot add more monies to it unless you're enrolled in a qualified plan. So you could hop back and forth every year or every couple of years if you wanted to do that as well.
Great. Thank you so much. Does anyone else have any other questions? Okay. Mike says, thank you. Great. Well, friends, continue to put in chat any questions that you have, and thanks for participating. This is helpful.
Yes, thank you, everyone. Again, just a reminder, if you don't want to make any changes for next year, you do not need to submit an enrollment form to the benefits office during open enrollment. We'll carry forward your current plan and coverage levels into 2023. So only if you want to make any plan or dependent changes for next year, then you do need to submit a group health benefits enrollment form to our office by November 15th. Excuse me, and we would prefer fax or email for that to make sure it's timely. Post office doesn't always get things quite on time. So, and also just remember, if you do have dependent coverage, please complete the Boone Chapman additional insurance form that's in your open enrollment packet. It's loose, it's a separate piece of paper. Fill that out, get that to Boone Chapman by January 1. So thank you everyone for participating, and have a wonderful Halloween.
Have a great afternoon, friends. Thanks for joining us.
Thank you.
Barbara.
Thank you.
Brian, y'all take care.
Bye-bye.
Yeah.